that the superior rectal veins, they are going to renew the inferior mesenteric vein, right? And as you can see, the middle rectal vein and the inferior rectal vein, they are going to communicate with each other with the superior rectal vein. So these communications, it is another example of the portosystemic anastomosis I told you, because the inferior mesenteric vein, it is a part of the portal venous system, and the middle rectal vein and the inferior rectal veins, these are part of the systemic circulation. So this is another place where the portosystemic anastomosis takes place. And in the cases of the portal hypertension, what will happen? In the case of portal hypertension, here the veins, they also become dilated. Okay? Due to the back pressure, backflow, right? So what are the two places where the portosystemic anastomosis were present? कौन बताएगा मुझे जल्दी से? बेटे, I don't have the time. Hurry up. Lower end of the esophagus, and second one is around the umbilicus, right? And this is the third place where the portosystemic anastomosis takes place. This is a viva question, right? Where the portosystemic anastomosis are present. So you have to tell that number one, that is at the lower end of the esophagus, right? Second one is around the umbilicus, and third one is at the anorectal junction, right? Or the is it clear? Ji? Okay. Now the lymphatic drainage. वेनस ड्रेनेज में कोई प्रॉब्लम तो नहीं है बच्चे? lymphatic drainage में बेटा जी upper part I told you, upper half by the pararectal lymph node basically towards the inferior mesenteric, right? And the lower half they are going towards the with the middle rectal veins to the internal iliac nodes or to the inguinal lymph node. The inferior rectal say these are going towards the inguinal lymph nodes. ठीक है? 3 blood supplies है ना बेटा. So through the upper part that is going towards the superior rectal vein के साथ जाएंगे ना towards the inferior mesenteric nodes. ठीक है जी? Middle part में the middle artery that will lead to the middle rectal artery, और यहाँ से they are going towards the internal iliac nodes, and in the lower part the inferior artery, rectal artery, इसके साथ जो lymph will travel towards the inguinal of the lymph nodes. ठीक है जी? Nerve supply में again same parasympathetic and the sympathetic, right? So sympathetic में the fibers are coming from the, you see, offload which is coming with the inferior mesenteric plexus. तो उसमें L1 L2 के fibers आ जाएंगे, right? और parasympathetic I told you the pelvic nerves के साथ they will be going towards the inferior, mesenteric plexus. ठीक है जी? Why the inferior epigastric plexus? ये हम इसमें बात कर चुके, right जी? Okay. Now the sympathetic जो है ना बेटा फाइबर्स, उसका क्या एक्शन होगा रेक्टम के ऊपर? सो द सिंपैथेटिक फाइबर ज्यादा वेसोकंस्ट्रिक्टर होते हैं. ठीक है. नंबर 2, दीज आर इनहिबिटरी टू द रेक्टल मसल्स. ठीक है. और दे आर मोटर टू द इंटरनल स्फिंक्टर. सो व्हेन दे विल सिंपैथेटिक स्टिमुलेशन होगी तो क्या होगी? आपके स्फिंक्टर्स क्लोज कर जाएंगे, मसल रिलैक्स कर जाएगा, राइट? वेयर एज द पैरासिम्पैथेटिक होगा तो क्या होगा? दे विल बी मोटर टू द मसल्स, मसल विल कॉन्ट्रैक्ट, and then the internal sphincter will relax so that the evacuation or the defecation takes place. Is it clear जी? कि problem तो नहीं है? And secondly, मैंने आपको बताया था ना कि normally it remains empty, and when it is distended, the distension lead to the stimulation of the defecation reflex, right? So this distension sensation they will be also carried by the parasympathetic system. ठीक है? जब आपके parasympathetic nerves they are carrying these distension, sensations. And the pain sensations, of course, they travel in both the pain sensations, they travel both through the sympathetic and the parasympathetic system. So, बच्चे, we have finished with the rectum till now. ठीक है? For clinicals of the rectum में the important thing है that we are going to do the certain processes for the diagnostic purposes. For example, we are going to perform an examination that is called as a PR examination. Sometimes the patient presents you with the complaint of bleeding through the anal canal. ठीक है? तो उसके लिए we are just going to use a PR per rectum examination, and to see that even if the blood is coming from the piles or the hemorrhoids. ठीक है? We'll talk about it in detail also. Okay. Then we are going to perform the proctoscopy. ठीक है? And then the sigmoidoscopy. So we are going to introduce, the anoscopic tube through the anal canal to observe the internal surface or the mucosal surface of the rectum, right? And there's certain condition which will lead to the prolapse of the rectum, right? And the complete prolapse is called as a presidentia, right? So uh, we have finished with the rectum right now, ji. ठीक है? And next time we'll be talking about the